everyone. Today, we're diving into some unusual signs that your heart might be in trouble. These aren't your typical chest pains or shortness of breath, but they can be just as serious. Let's decode 15 of these strange signs your heart might be crying out for help. Early detection is key, so let's get started.
If you're experiencing pain or pressure in the center of your chest that spreads up into your throat or jaw, don't brush it off. This could be more serious than you think. This is a classic sign of a heart attack, and it's particularly common in women. Women often experience different symptoms than men. Now, I know what you're thinking, Dr. Mike. Isn't jaw pain usually just a toothache? And you're right, it often is, but it's crucial to consider the context and other symptoms. But when it comes to your heart, it's always better to be safe than sorry. Early detection can save lives. If you experience this kind of pain, especially if it comes on suddenly or is accompanied by other symptoms like shortness of breath or nausea, call 911 immediately. Don't wait, every second counts. Feeling unusually tired, like you just can't catch a break, even after a good night's sleep? This could be your heart sending an SOS. Extreme exhaustion or unexplained weakness, sometimes lasting for days, can be a symptom of heart disease, especially in women. If you're constantly feeling drained, don't just chalk it up to stress. It's crucial to talk to your doctor to rule out any underlying heart issues. They can run tests to check your heart function and help you get to the bottom of your fatigue. Ever notice your ankles looking a little puffy, especially at the end of the day? This swelling, also known as edema, can be a sign that your heart isn't pumping as efficiently as it should be. When your heart isn't strong enough to circulate blood effectively, fluid can build up in your legs, ankles, and feet. If you notice persistent swelling in your lower extremities, don't ignore it. Make an appointment with your doctor to get it checked out.
Shortness of breath, it's a very common symptom in a lot of illnesses and conditions. People think of COPD or interstitial lung disease or pulmonary hypertension, but it can also go along with conditions like heart failure and cancers.
We all get winded from time to time, especially after a workout, but if you find yourself struggling to catch your breath, even after minimal exertion, it's time to pay attention. Shortness of breath, especially during routine activities like climbing stairs or walking short distances, can be a red flag for heart problems. When your heart can't pump blood efficiently, it can back up into your lungs, making it difficult to breathe. This is a serious symptom that should never be ignored. Ever feel like your heart is doing a drum solo in your chest? Or maybe it feels like it's skipping a beat or fluttering for no apparent reason. These sensations, known as palpitations, can be unsettling. Arrhythmias occur when the electrical signals that control your heartbeat don't function properly. While not all arrhythmias are dangerous, some can increase your risk of stroke or heart failure. If you're experiencing frequent or prolonged palpitations, it's essential to get checked out by a doctor. Breaking out in a cold sweat or feeling dizzy, especially when you're not overexerting yourself or in a hot environment, can be a warning sign of an impending heart attack. These symptoms occur because your heart isn't getting enough blood flow, which can disrupt your body's temperature regulation and cause a drop in blood pressure. If you experience sudden, unexplained sweating, lightheadedness or dizziness, especially if accompanied by chest pain or shortness of breath, call 911 immediately. We usually associate stomach issues with something we ate, but sometimes those gut feelings might be signaling a heart problem. Indigestion, nausea, or stomach pain, especially if they occur suddenly or are accompanied by other symptoms like chest discomfort or shortness of breath, can be unusual but possible signs of a heart attack, particularly in women. For our overall health, but did you know that heart problems can actually disrupt your sleep? Conditions like sleep apnea, where you repeatedly stop and start breathing during the night, have been linked to an increased risk of heart disease. If you're consistently struggling to get a good night's rest, or if you snore loudly or wake up gasping for air, it's crucial to talk to your doctor. We usually associate a cough with a cold or allergies, but a persistent cough, especially one that produces white or pink phlegm, can be a sign of heart failure. When your heart isn't pumping efficiently, fluid can build up in your lungs, leading to a chronic cough. This type of cough is often worse when you're lying down and may be accompanied by shortness of breath, fatigue, and swelling in your legs and ankles. If you have a cough that just won't quit, don't ignore it. This one's for the guys. Erectile dysfunction, or ED, can be an early warning sign of heart disease. The same blood vessels that supply your heart with oxygen-rich blood also supply blood to the penis. So if these blood vessels are narrowed or blocked due to plaque buildup, known as atherosclerosis, it can affect both your heart health and your ability to achieve or maintain.
The same process that goes on in the vasculature in erectile dysfunction is also involved in vascular health in the coronary.
If you're experiencing ED, don't suffer in silence. Talk to your doctor. It could be a sign of a more serious underlying health issue. We often associate shoulder or arm pain with muscle strain or injury, but it can also be a sign of a heart attack, especially if the pain is sudden, unexplained, and occurs on the left side of your body. This referred pain happens because the nerves that carry signals from your heart and those that carry signals from your arm and shoulder travel along similar pathways. Our skin is our largest organ, and it can often provide clues about our overall health, including the health of our hearts. If you notice your skin taking on a bluish or greyish tint known as cyanosis, especially in your lips, fingertips, or toes, it could be a sign that your heart isn't pumping enough oxygen-rich blood to your body's tissues. Ever notice your skin feeling cold and clammy like you just stepped out of a cold shower even though you're not cold? This unsettling sensation can be quite alarming, especially when it happens unexpectedly. This, along with pale skin known as pallor, can be a sign that your heart isn't pumping blood effectively. Pallor can make you look ghostly, as if all the color has drained from your face. When your heart struggles to circulate blood, your body prioritizes blood flow to vital organs like your brain and heart, diverting it away from your skin. This is your body's way of protecting the most crucial parts of you. If you experience these symptoms, especially if they come on suddenly or are accompanied by other symptoms like chest pain or shortness of breath, seek medical attention immediately. These could be signs of a serious condition that needs prompt treatment. We often associate upper abdominal pain with indigestion or heartburn, but it can also be a symptom of heart distress, which is often overlooked. This is especially true in women. This pain, which can feel like a burning, aching, or tightness in your upper abdomen, can be misleading. This occurs because the nerves that supply your heart and those that supply your upper abdomen are located close together. If you experience persistent or unexplained upper abdominal pain, especially if it's accompanied by other symptoms like nausea, dizziness, vomiting, or shortness of breath, it could be more serious than you think. It's essential to see your doctor to rule out any heart-related issues and ensure your health is not at risk. We all experience anxiety from time to time, but a sudden, intense feeling of anxiety or a sense of impending doom, especially when combined with physical symptoms like chest pain, shortness of breath, or sweating, could signal a heart attack or another serious heart issue. If you experience this type of anxiety, especially if it comes on suddenly and is accompanied by other concerning symptoms, don't hesitate to call 911. Remember, these signs might seem unrelated to heart health, but they can indicate serious cardiovascular problems. If you notice any combination of these symptoms, especially if they occur suddenly or persist over time, consult a healthcare provider. Early detection is key to successful treatment. Stay healthy and take care of your heart. Don't be afraid to advocate for yourself. Your health is your most valuable asset, so make it a priority.